Today, we'll be discussing traumatic brain injury, reactivated Lyme disease, new Lyme disease, mold biotoxin illness. We'll be speaking with Cindy from Arizona. You had symptoms, but you were misdiagnosed.
So I had a lot of neurological symptoms. I was diagnosed with, MS. They were right on the border of diagnosing me, but I didn't have any lesions on my brain, but I had all the same symptoms. I had my one leg was dropping and all kinds of things. They had me on everything known to man, 9 different pharmaceuticals just to kind of mask everything. And the antibiotics saved my life right at that moment, but they didn't get me better all the way. All they did was bring me to a point where I could function again.
That's how it goes with chronic Lyme, that most of us get misdiagnosed.
Well, I feel like Western medicine just treats sick care. They don't want to get you well. They just give you something to mask it and then call it good. You treat the entire body, like completely from top to bottom, and that's very rare. Most doctors don't even know how to do that.
Hello, welcome back to BioNexus Health Podcast series. Today, we'll be discussing traumatic brain injury, reactivated Lyme disease, new Lyme disease, mold biotoxin illness. We'll be speaking with Cindy from Arizona, and Cindy is an absolutely amazing lady. She's been through so much in life. She has had a lot of medical complications. Cindy is one of the bravest, well-spoken, and a complete trooper when it comes to taking good care of herself, doing phenomenal research, getting the best of treatments, and overall kind of hanging in there, because there is a lot of ups and downs that we all go through, right? All of us Lymies and moldies, as people say. So those of us with chronic Lyme disease, with chronic inflammatory response syndrome, SIRS, or mold biotoxin illness. But there is a pretty happy ending. So I would like to welcome Cindy to today's podcast. And we are very fortunate to have her on today's podcast and, sharing her remarkable journey with us today. Hey, Cindy, how are you today?
Good. How are you?
Good. Thanks. How's Flagstaff? How's the weather?
It's actually getting beautiful here. We're in the 60s, almost to the 70s, and it's been gorgeous.
Oh, good. Wow. Yeah. We are hoping to have some sort of a decent spring this year in the Northeast. I mean, it's been really crazy, the weather, with the rain and the crazy freeze overs and floods just last week.
Yeah.
So, yeah.
I just realized my dryer is running. Can I turn it off, or is this going to be part of the video?
No, not at all. I can just hold on one second. Let me pause the recording. Yeah.
Sorry.
That's the problem.
All right. I think I'm good now. I won't have to leave again.
Oh, no, that's fine. That's fine. It's pretty informal, right? We just want to let people watching have a little peek at the fantastic journey. I mean, it's been arduous. It's been a very slow recovery that you've had, but you stuck with it. You're just one of the bravest people I've met. You're absolutely amazing. I think, as your physician, I'm saying that, but
well, thank you. Sometimes I don't feel that way, but
yes, no, it's your journey's been, I mean, I believe you had mentioned that your first tick bite was when you were 11 years old.
Yeah, like in 1979.
Wow.
Or no, yeah, 78. Yeah.
Okay. Yeah.
And then the second one, I think, was in 2016. I'm guessing right around there. I had never really narrowed it down, but I didn't get diagnosed until like 2019.
Right.
So 3 years of doctors misdiagnosing me.
Yes. I do remember you mentioning that you woke up with what you thought was a big fat beetle.
Yeah, and I hit it. I smashed it, and all this blood came out, and I'm like, why is there so much blood? I didn't know about ticks back then, and I was totally uneducated on them. So I wish I would have saved it and looked at it, because I probably could have saved my own life if I did.
So it was actually an engorged tick,
It
which
was
had been on you, and then it got so big because it finished its feeding, and then it just dislodged itself.
And it was under my pillow. Like I'm
Under
making the
your-
bed, and it was under my pillow. So I'm like, where the heck did that come from? And yeah. So I saw it, but I didn't know. Now, like today, if I see them, I grab them, put them in a jar, and look at it.
Yes. Yes. Send them out to be tested and what have you, right?
Mhm.
So for 4 years, you had symptoms, but you were misdiagnosed with what? Traumatic brain injury.
Well, so I had a lot of neurological symptoms, and so they were almost like trying to diagnose, well, obviously fibromyalgia because I had so much pain, but I was diagnosed with, MS. They were right on the border of diagnosing me, but I didn't have any lesions on my brain, but I had all the same symptoms. I had my one leg was dropping and all kinds of things. But, it was, then they also, they had me on everything known to man, 9 different pharmaceuticals just to kind of mask everything. And,
Right.
that obviously wasn't the solution.
Right. And you've been to some of the best clinics for MS, for brain injury, for, you've been on all the treatments, pharmaceuticals, diets, intravenous treatments, antibiotics, the works.
Yep, absolutely. And, really, when it comes down to it, when it boils down to it, the antibiotics saved my life right at that moment, but they didn't get me better all the way. All they did was bring me to a point where I could function again, but never really completely got me to where I could, live my life.
Yes. I hear this quite often, unfortunately, but that's how it goes with chronic Lyme, that most of us get misdiagnosed. I mean, I got the same labels slapped on me.
Yeah.
It is chronic fatigue, fibromyalgia, depression, anxiety,
I
postpartum.
had all those, every one of them.
Right. And these can often be symptoms of something underlying versus just being so-called syndromes all on their own.
Well, I feel like Western medicine just treats sick care. They don't want to get you well. They just give you something to mask it and then call it good. Don't even try to find the source.
Right. Until you have another relapse and then the whole thing starts all over again. Right. And I get you. So what brought you to herbal medicine and BioNexus Health?
Well, so when I went to the integrative place in Scottsdale, they did a lot of herbal stuff too. And they did, Western and allopathic and all that together. And basically, the integrative part of it wasn't big enough for me. Like there wasn't enough of it. And so after I had finished with that treatment, I, it was almost 2 years before I started with you, but I started getting worse, progressively worse again. And so I started looking into other protocols and things, because I wanted to do a natural treatment because people were saying that works in the long run, doing plant-based stuff, taking it for a long period of time. And so I've had quite a few people that I made friends with that were Lyme patients say that they ended up going this route, plant-based herbal route, after they did antibiotics because, the antibiotics helped, but didn't get them where they wanted, get in remission, I guess is where my goal was.
Right. When did you lose your MS diagnosis?
So when I did the IRAD Rocephin treatment, where they open up your blood-brain barrier,
Yes.
drop your blood sugar, and then a lot of my neurological symptoms went away. But I still had the dizziness. The dizziness was the biggest thing that I hunted for 10 years. And, I basically went to, world-renowned doctors.
Yes.
They could never once even thought to ask me about Lyme disease or mold toxicity. They went in all these crazy directions that I never got anywhere with anything. And, so that's when I felt like I was totally being mistreated by Western medicine because of that. Because if I would have been diagnosed sooner, I wouldn't have ended up with the pacemaker. So, and I feel like that is the end all for, knowing that I've had chronic long-term Lyme for a long time and had a heart problem for 4 years. And the antibiotics did not solve it because it was too late. I mean, I already had permanent damage apparently. So
yes, yeah, IV Rocephin helping you. It's one of the early treatments that is used for tick-borne infections, So where did you
I didn't know if you wanted me to,
experience?
did you want me to mention the place that I went? Because I didn't know if you wanted
No,
me to.
no,
Okay.
actually.
Where did I?
So no, sorry. I was going to ask you, where were you exposed to mold?
So I bought a townhouse about 10 years ago, and the house before I bought this one had mold in it, and the house before that one had mold in it. And
Uh,
I was aware both of them they were both rentals because I had been in the middle of my divorce and all that. And so they had, halfway fixed the leaks and the mold and whatever, and never really did it correctly. And then when I moved in this townhome, found out there was a roof leak and that there was mold in the attic. And so I was getting worse and worse when I was here the first 2 years. I got the second tick bite here. And so, I was being exposed to mold at the same time and the tick bite. And so I basically started my journey in 2017, took my breast implants out to try to help my immune system, also to get rid of all the heavy metal toxicity from the breast implants and try not to feed all of everything that was, all the bugs. And then, 2018, my gallbladder, Lyme disease took my gallbladder, and then, finally got diagnosed at the end and started getting treatment in 2019.
in 2019, yes. The thing with the mold exposure is chronic inflammation, as you know, right? Chronic inflammatory response syndrome. So infections love inflammation. So people who think they are going into remission with chronic Lyme, they have relapses because infections will come right back up if there is still chronic systemic inflammation in the body. And, it's important also to understand that mold illness, as well as Lyme disease, they affect multiple organ systems, just like we've seen with you. I mean, when you had treatment that opened up the blood-brain barrier and your brain was treated from the infections. Additionally, you had your vertigo, you had your cardiac symptoms, POTS. Now, all of these ultimately you ended up with the pacemaker, but the pacemaker was a great addition because it really solved a lot of problems for you, didn't it? You recently had a pacemaker put in.
Yeah, and I'll go back to the pacemaker conversation, but I just wanted to talk about the fact that they were saying I was getting early dementia. So that was one thing that was starting to happen just before I did the treatment. Like I totally couldn't remember anything. And I've always had a great memory, and it was terrible at that point. I kind of felt like I did. I was going, and of course the bacteria in your brain makes you look like you have it.
Yes, it does. It almost sounds like medical gaslighting in a way.
Oh yeah, no, I totally felt that way. I still do to this day. Just did, a month ago with my pacemaker. So back to the pacemaker, I didn't realize how many things were connected to that because, I have had symptoms for 4 years. The cardiologist dismissed me, basically said, "Oh, you seem like you're doing fine." And then finally I went back and I said, "Hey, I want you to test me." They put the Holter monitor on. 5 days of the Holter monitor, found 100 heart block episodes in those 5 days.
100 heart block
100 in 5 days. And so I was having panic attack, cortisol release, anxiety, feeling like panic during the day when I was driving. I would wake up in the middle of the night feeling panicked. And since the pacemaker, all of my panic attack feelings and anxiety are gone. So I drove yesterday for like 6 hours all over the place, all over the city. And that was the first time I could actually really feel like anytime something close would happen, I would start to panic and feel like I kind of wasn't in control or whatever. So now with the pacemaker, it's changed. And there's another huge thing that with the pacemaker, I was having tremendous headaches, and I would wake up and like clamping headache in the back of my head, like my occipital region, and really super fuzzy. And I would wake up in the middle of the night with those really bad headaches and feel super dizzy, like I was drunk and hadn't even drank anything. And so those symptoms have completely subsided too, which I think is probably attributed to the fact that my heart rate was in the 40s at night.
Right.
So I wasn't getting enough oxygen because they have it set at 60. They had it at 50 at first, and I wasn't feeling much improvement from it. And then they set it at 60. And so it paces me the entire night.
Okay.
Like when I look at my sleep watch thing, yeah, it paces me for the whole 8 hours. So,
What challenges and what improvements did you see with herbal medicine?
well, it's I'm a impatient person. And I want things to happen quicker. And it seemed like I was so bad. And when you told me that we were dealing with like a huge load, that I had to be more patient because I knew it was going to be slower because, antibiotics, like boom, they hit you and usually help you right at the moment, but not for long term. And so it was a matter of just being patient because I knew it was going to take time. But for the most part, the herxing was a little bit bad in the beginning and but I think the treatment was pretty easy for the most part. Just a lot of counting drops.
Yes.
But yeah, easy. Other than that, like I didn't have a bunch of side effects or anything.
Great. And what improvements did you see? What benefit?
Well, I feel like when I started with you, I was not in remission in any way, shape, and form. My gut was just a complete and absolute disaster. And I've had tremendous, now that I look back at things, my energy has gotten way, way better. The pacemaker took me all the way, I think, to where I needed to be 100%. But, my stomach is way better. I have way less food allergies because I was just allergic to everything that I was trying to eat. So that's been huge. My headaches, because my headaches were the biggest thing, I think, when I first started seeing you. I had them constantly. And I only maybe get one once every couple of weeks now.
How's your sleep?
That's funny that you ask because it was getting better before the pacemaker, but not all the way better. And I still had some pretty crazy rough nights because I had central sleep apnea, which found out later on after the pacemaker that it was all caused by my AV block. So all my symptoms for the sleep apnea have gone away. And, the biggest one was I would wake myself up and then have panic and wake up in the middle of the night and not know why I was panicking. And so that's huge. And so I think, probably just the medication or just the plant-based stuff itself probably got me to like 60% better sleeping. And then the pacemaker's gotten me probably to like 85%. So
With your sleep.
Yeah, way, way better. And I'm only usually awake about an hour in the middle of the night instead of 3 hours because my stomach would keep me awake in the middle of the night.
That's great. That's really good to hear. People with mold, chronic Lyme have a lot of complaints of sleep apnea because we know that mycotoxins, mold toxins can target the lungs. We also know that co-infections that come with Lyme disease, like Babesia, they can target the lungs, right? We also know that parasites, which are opportunistic infections or, additionally cystic form of Lyme. So, these can all be factors which can impact sleep apnea in patients with mold and Lyme. One of the other co-infections is Mycoplasma pneumonia. And then the one other thing that you mentioned was cardiac issues, AV block in your instance. And all of these are not even looked into. They're not looked You have sleep apnea, here's a CPAP machine, and that's it.
I've told 3 of my friends recently to get tested for mycoplasma. They all have asthma because I have a friend that got treated for mycoplasma and her asthma went away. So I had it. My numbers were super low when they tested me though. And so they didn't treat me at the facility I was in. So, but Babesia, I had three strains of it, I believe. Yes. So it was kind of the beast, I think, in the beginning. And then Bartonella, I think turns out it's a little more hardcore than the Borrelia for me anyways, because I had 3 strains of Bartonella too.
Yes. 3 Babesia, 3 Bartonella. Yes, Bartonella.
And 3 Borrelias. So 3 strains of all of them, which is
fully loaded.
Yep. And then, Rickettsiosis, Rickettsia, Rocky Mountain spotted fever. I had every single bacteria you could possibly get from a tick bite.
Yes. Yeah. The first tick bite where you had the tick attached to your head, I believe you said, right? When you were
both of them were on my head, I believe.
Yes. Mm-hmm. Yeah.
That's what having lots of hair does for you. So I always put my hair back in a ponytail and put a hat on anytime I'm going out in the forest ever again for the rest of my life because it makes it harder for them to get in your hair.
Correct.
So that's the life I'm living, and long pants when I'm in the forest.
Yes. Yes, yeah. I mean, you can still do whatever you want to do. I mean, going out there, going on hikes, going in the woods, taking walks, being in nature. You just have to exercise due caution. Same, with most of us. You wear a hat or a cap
and you don't sit
long
under a
sleeves,
tree,
and you
right?
don't. Right.
Because I used to sit under trees for shade, and I'm like thinking now, I'm all like, I don't want to go under a tree, but I have lost my fear of it a lot more, because that's another thing since the pacemaker that I was and this, I think from the beginning of when you started treating me to now, I was very, very afraid of everything. And I was still in a huge fear of just the unknown of getting reinfected and all that. And especially mold too, like that's a panic thing for me still. If I see mold somewhere that I instantly tiny bit panic. But for the most part, I feel like that this treatment protocol has gotten me out of that whole feeling of fear. And so have you, since your mindset, it's helped me realize that if I did get another tick bite, I'm not going to die from it, because we know how to deal with it now.
Exactly. Yes. No, you're not. That's true. Many people feel empowered, as we should, myself included, knowing that, we don't need to go back to heavy duty pharmaceuticals and the side effects and what have you. If we ever get exposed to mold again, or if we have a tick bite, we have very powerful herbs at our disposal. Plant-based medicine seems to do the exact same job, if not better, because plant-based medicine goes deeper into the tissues and cells, and it just clears everything out. That's the reason why sometimes people have heavier die-off or Herxheimer reactions from plant-based medicines, right? I'll have people come to me, hey, I've done IV therapy, this, I've done antibiotics for a couple of years now for my chronic Lyme. I've done heavy pharmaceuticals for SIRS. So yeah, bring it on. You're going to give me a little binder. You're going to give me a couple herbs. So, and then 2 drops. And I have someone who is like 6'2", 185, 200 pounds. Like, oh my God, I'm in bed. I can't move.
So I have to tell you, I was on 9 pharmaceuticals, and I'm off every one of them.
You're off every one.
Awesome. Every one of them. All I take is hormones and thyroid medication, and those are all bioidentical. And so nothing else at all, which is amazing. Because I was on antidepressants, anti-anxiety, proton pump inhibitors. I mean, everything known to man that's terrible for you, I was on.
Yeah, and we managed to get you off everything, just the basic bioidenticals, which is okay, which of course, is a necessity. Often for people with chronic Lyme and biotoxin illness as well. Good. Well, what a few years you had. I'm glad you are where you are today, at feeling so much better in full remission.
I don't know if we even talked about how extreme I was, because that's something that people should know. Like,
yes,
they basically diagnosed me with late stage neuro Lyme disease. And he basically told me that I had the highest pathogen count that he has had in any patient. And he was very, very perplexed as to why and how I was even functioning, walking, functioning normally, or any of that sort, because with somebody with such a high pathogen count, usually, and I was 93 pounds and I was pretty close to death. Most people don't make it. They just give up because, it's pretty brutal. And I'm definitely a strong fighter, so I wasn't going to give up. And I'm glad that I found you, because I felt disappointed in the original treatment that, I was so hopeful that I was going to get in remission from that. And I kind of felt like I was in the beginning, and then it came right back, like, probably 6 months.
Yes. Yeah. Now your mold labs numbers are down. I mean, you already knew that you had a lot of infections to deal with, which could, resurface at any time. And then we found more in your gut.
Yeah. And the other crazy thing, my mycotoxin test, we should talk about that. My original one, I think, is it mycophenolic acid? was at 9,000. That's insane. Like the doctor was like, I've never seen a mycotoxin that high in my life. And he said, oh, that's the one they give to patients that to suppress their immune system when they get an organ transplant. My friend that just got an organ transplant's on that. So that was like probably the biggest problem of all, suppressing my immune system and then letting it all take over.
Yes. You had extremes in most of your labs, if not all. Yes, your numbers were very high. And you're right. It's very important to let people watching know this, that, you know, with plant-based medicine, you can bring the numbers down. I see that all the time, Cindy. I'm glad you saw that as well. In all age groups. In all age groups, you know, I've right now, currently, the youngest I'm seeing is 7 months from California. Yeah, the oldest I'm seeing is, interestingly enough, 84, also, no, from Hawaii, actually.
Oh, okay.
The oldest patient. And, you know, every other age in between those two. We'll be having newborns soon. I have one
that are born congenitally with it, or with Lyme disease, or
we are
autism?
hoping not. We are hoping not. You know, she did start preconception with me because her older son has, the first child has autism.
Okay.
So she started, so we did everything we could, you know, genetics, MTHFR, balance her out, you know, detoxification, identification of all triggers. So she went into her family planning pretty much clean. Yeah. So we're expecting, you know, a Lyme and mold baby on the way, and hopefully, you know, I'm hopeful that it's the baby. He or she, we don't know yet, is going to be pretty clear of both, because mom was pretty clear. So that would be interesting. But I've had Lyme babies before where mom has, you know, started with me in the middle of the pregnancy, where we couldn't really do a whole lot with herbs because everything is informed consent at that time, right? Mm-hmm. No one's going to touch you. Your immune system is beautiful. During pregnancy, it's ramped up, it's handling everything, but we have to be ready once the baby is delivered to make sure that the baby is fine. And, you know, once the immune system comes back to normal, the mom can crash with Lyme again. So that is something that I've had to deal with, you know, several times with clients, but I'm kind of used to that. And we have been able to help moms.
That's amazing. I'm glad you can actually catch it young, or when they're young, so they don't end up in the situation like I was.
Yes. Yeah.
Extreme.
You did. Yes. You know, from, I wish it was caught, you know, you were given some kind of treatment, even at 11 years of age. And because I don't really know how many bacteria I got from that, and if I passed it on to my children. I did get my son tested, and he tested positive for Babesia. So I know I transferred some stuff to him because I didn't have the second tick bite before I had him. So we treated him, and he seems a lot better because he was having a lot of symptoms from it. So a lot of anxiety and sweating, and he was having a lot of, he was not sleeping for when he was young, from like 16 to 18, really bad insomnia. And so after we treated him, he's stopped his night sweats and he's sleeping way better. So I'm assuming they probably do have it. And at some point, you know, it's going to need to be tested, and hopefully it doesn't come to the surface too soon. My daughter's 30 and my son's 26. So, okay.
And they're both healthy at this point, but other than the treatment for my son.
Yeah. Fingers crossed, you know, they should be okay if they've both been treated. But yes, you know, it's important to educate them about mold to make sure that my daughter actually had her house partially flooded. So I was all over the remediation company. I went there. I basically was the person directing the situation. You're going to cut the drywall here. You're going to do that. You're going to remove that. You're going to scrub that. You're going to spray that. I did. I was basically the person directing the mold, because I said, yeah, you can do it, but I'm going to be there. So, because my daughter is sensitive, and her whole family, I'm sure, both my grandkids, because I have 2 copies of the HLA. I have 2 copies of the MTHFR. Yes.
My daughter was tested. She has 2 copies of the MTHR. She has the worst one, the 1298C and the what is it?
C677.
She has both of those. So she has the worst one. I have 2 of the 1298s or something. So,
Yeah.
but at least we're aware of that. And so they're on binders and stuff too, because they know now that they don't detoxify properly.
Good.
Yeah.
Well, awesome. I hope and pray that your journey to wellness just continues with an upward graph from now on.
Yeah. And I plan to be an advocate and totally, help people be aware of Lyme disease. So, isn't it Lyme Disease Awareness Month? I've been making sure I tell one person every day about Lyme disease. I've been wearing this necklace every day. I put a Lyme disease awareness thing on my car.
Oh, beautiful.
And so people ask me about it.
The
So,
ribbon.
but that's I'm trying to at least educate people. I educated my electrophysiologist, by the way, the other day, just so you know. I said, do you even know why I got the pacemaker? And he's like, well, you had bradycardia and heart block. And I go, what was it caused from? And then he said, well, I think in here, I go, does it even say Lyme disease anywhere in my record? And he goes, well, in this one part, I go, I want it in the main area and I would like you to start typing. So I had him type in Lyme disease and and I explained the whole thing to him and I made him put it in my medical record. And then I said, you should educate. I brought him a pamphlet about Lyme carditis and said, you should educate everybody in this clinic about it. Because the one PA, she was the only one, and she said, oh yeah, ehrlichiosis or rickettsia or however you say it can cause that. She didn't even really know about Borrelia, which is scary. Right. So, and then I told them about the whole Lyme carditis lawsuit thing of the kid in Massachusetts, and that you guys should probably really, research all that stuff and cover your butts. And so he was nice about it, but you could tell he didn't want to listen to me.
Yes, people get very comfortable doing what they do, day in and day out, pays the bills, maybe beyond paying the bills,
Mm-hmm.
and that's it. They don't want to know more. They have blinders on, they don't want to take on any major organizations. They're like, I'm fine doing what I'm doing.
Yeah, but how about you're supposed to be helping people and saving people's lives?
Yes.
I basically brought my butt in there, asked them to put the monitor on me, and then they said we would recommend a pacemaker, is what they told me. Not you should really have one immediately, because you could go to AV3 within weeks.
Right.
Because basically a Lyme patient can go from AV2 to A3 almost immediately.
Yes, they can. I remember a 22-year-old mom was a physical therapist, and she brought her son to me, and her son was on the spectrum, but high functioning, pretty adamant. And the only reason why he agreed to see me was because I had a son on the spectrum. So that kind of, he said, all right, she knows what it's like, so I'll go see her. And we did testing, we did labs, and I told his mom that the heart is not looking good. All the signs are pointing. I would get a scan, right away. I would see a cardiologist right away, and they did. And apparently, he was less than a week away from needing emergency surgery for his heart.
Yeah, that's scary that it gets to that point where nobody sees it till then.
Right.
Because my EKGs were normal.
Yes, that's another thing. That's right. EKGs were normal for him as well. It was the echo that showed something.
Yeah.
And then they put, and then they monitored him, and then they ended up doing additional scans. And that's when they said, we need to get him into surgery. He's touch and go any moment. And he was only 22 years old.
Wow.
But he had a massive tick bite at 7 years of age. And it was like, oh, that's a dog tick. So you don't have to worry about it.
Mine was a dog tick. Mine were both, my dog had a dog tick and mine was a dog tick. Because I have not seen deer ticks in our neighborhood, but there are dog ticks, and it was brown. So yeah, but yeah, my dog had one last summer from our backyard, and it tested positive. I sent it to tick check, and we treated her.
Yeah, sometimes dogs get treated better than people. They get dewormed, they get proper treatment for Lyme. Yeah.
Yeah, and how can they test it so easy? Like they just tested my dog, the one I rescued in Mexico, with the Lyme test, along with a bunch of other things all together in this one test. And I'm
Right.
like, why can't they do that for us?
Right. Yes. For humans,
Because
Lyme
they want to
testing
keep
has.
us sick.
Oh, yes. I just heard yesterday, well, I don't want to get into the powers that be, right?
Yeah.
But just yesterday, I heard that the most natural medicines for thyroid have been put on the shelf now.
Oh, really?
So only the heavy duty, pharmaceutical drugs could be used for people with thyroid problems. So anyways, but that's
I use compounded
discussion.
stuff from a compounded pharmacy.
That is still possible. Yes. So
Yep,
if
that's
you
what I do.
have, if you have a smart endocrinologist who understands bioidenticals and
Yeah.
is able to use compounded stuff, that's what I use as well.
Yeah.
We are lucky that way. But common public, regular people who are just once again, without looking at root causes, are just generally diagnosed with Hashimoto's, with right, additional thyroid, low thyroid, hypo. I mean, these things don't just happen. Autoimmunity doesn't just happen. There is a root cause.
Something causes it, yes.
Right. Oh, you
Yeah.
have MS. Like, yeah, but why? No, you just do. What does that even mean?
Yeah,
How did that happen? Why did my neurons go rogue? What
Mhm.
happened? I don't have a family history. What happened? What do you mean I have depression, anxiety? I've been the brightest, bravest person my whole life, and what does that even mean? How did that happen?
Yeah. No, it's bizarre what it does to your brain too, because we were just talking the other day about Lyme rage, and that it puts you in a state where you're in fight and flight all the time, and so it's super easy to lose it super fast because you're already there. You just need something to trigger it. It's not like you have to build up. It's already built up. You just, and that's one thing that's pretty much gone away 100% for me.
Your anger, aggression is down.
I don't let anybody get me triggered anymore like I used to. So, which is amazing.
Yeah. Wonderful.
Especially in my line of work, because real estate can be a little stressful.
Yeah. Little.
Yeah, just a little.
Well, it was amazing having you here today, and I know it's going to help a lot of people. I mean, I've had such positive feedback that I started with just as almost as a public service, because so many families were asking me that can you have other patients talk about their journey, and is it even possible to heal using just herbs? I'm like, it's not just herbs, it's
well, the other thing
plant-based medicine
we didn't talk about is that how you treat the entire body, like completely from top to bottom, and that's very rare. Most doctors don't even know how to do that. And so it all comes together and creates the situation I ended up in, right? All of this whole body problems that I had created the situation I ended up in, not just the Lyme and that. And so, that's really important for people to understand, that you have to treat the whole body, because you'll never get there if you're just doing one thing or the other. And that's kind of what I felt like they did before. They didn't treat my whole body.
Right. And then you end up with a relapse.
Yeah.
When that doesn't happen. Yes. I learned this the hard way. It took me 7.5 years to help my son.
Yeah. Wow.
And I could have done that. I mean, I wasted 4 years, with the various specialists telling me that there's no such thing as SIRS. There's no such thing as mold biotoxin illness. It's all hoopla. I had an appointment with Dr. Shoemaker for my son in 2011. And, because of all these things that I heard from other practitioners, like world-renowned, huge practitioners, specialists, I canceled that appointment, and I did not.
Oh no.
I did not revisit for another 4 years.
Oh no. So I kind of put my situation off here and there too. And it's pretty complicated to, I went to several world-renowned doctors for my vertigo, because that vertigo was probably the number one worst symptom that I had out of everything, because I couldn't drive, I couldn't function. It makes you want to throw up. And so I went to several that were like world-renowned, and never once did any of them ever mention inflammation, because the breast implants cause systemic inflammation. So I had that going on, and then the foreign object occupies your immune system too, so then it weakens your immune system. So nobody ever mentioned that either. And then not one of those 10 doctors ever said, hey, maybe we should test you for Lyme disease. Not one. Or mold toxicity, because the Western medicine guys, like you said, they don't take the time to educate themselves on the newer stuff that is understood now. Like leaky gut, for instance. That's been around for a long time, but there was nobody treating it because nobody believed in it.
Right. Everyone believes in just suppressing the symptoms. You have reflux. Well, it could be H. pylori. It could be eosinophilic esophagitis. It's an itis. It's an inflammation. So you want to investigate that? No, here's some PPIs. You just go and destroy your stomach acid, which is essential for digestion.
I took that proton pump inhibitor for 10 years.
Yes.
You want to know something interesting? When I removed my breast implants, I lost 20 pounds in 2 weeks.
Oh, wow.
Of inflammation.
Right, from inflammation.
And then, 20 symptoms went away too. I had 74 symptoms when I removed them. So I still had 50 some left after the backlash of everything.
Yes.
From the breast implants coming out. So, and I had mold around my breast implant. I had saline. I don't know if we ever talked about that. That's probably where the whole mycophenolic acid came from. The valve was leaking in the saline implant and letting it body fluid into the implant, and then the water back out. 15-year-old nasty water back into my body. So
unimaginable. Unimaginable.
Then,
when you look about it that way.
You know how a foreign object is supposed to form a capsule around it to protect you, right? Well, my left one had a capsule, my right one had no capsule whatsoever. It was paper thin. They had the Lyme disease and everything had been eating the tissue because they liked the heavy metals and all that. And so there was pathogens living around my implant for who knows how long. Because the fluid amount was way less in it than it was supposed to have in it. So it had been going on. And I was going up and down in elevation all the time. So creating the pressure in the implant.
Pressure differences, right.
Mm-hmm.
Right. I've had, excluding you, I've had 3 other patients with implant issues.
Yeah.
Yes. Some symptoms similar, some different, but yes, very, very toxic, high levels of many different toxins, which can all trigger biotoxin illness.
There's like 18 heavy metals in the shell of a saline implant, and I was toxic in 9 of them, like off the charts before I started chelation. And I did 3 rounds of chelation.
Yes.
So I think that's very helpful too, because my lead numbers were off the chart. I owned an auto repair business forever. And so my lead numbers were off the chart, and we got my numbers down into where they're actually in a safe zone.
Right now,
surprising.
Yeah.
Well, because people say you can't do it. You can.
Yes, you can.
Yes, you can.
Years and years of experience. I have, little autistic children from developing countries, extremely high lead numbers, and all we use is plant-based.
And do they get it from lead-based paint or?
Yeah, developing countries, there are various sources, right? Toys and I don't think I don't know if there's lead paint so much anymore. Maybe there is. I haven't, but toys and what have you. So I guess, in a way, it is lead paint in the toys.
Well, they stopped using lead-based paint on houses in 1978 when they realized.
In the
United States. I don't know if there's any kind of protocol in any other countries about it.
Right. I'm not aware either.
Yeah.
I'm not aware either. I have, many clients with high lead, and we've been able to bring it down. No problem. You don't need to go in for intravenous chelation or do crazy chelation protocols. The thing is, you need to understand what are the, collaborating toxins, which have to be dealt with at the same time as heavy metals. And it's not always collaborating toxins. It could be collaborating microbes, like with heavy metals, one of the collaborating microbes could be yeast. It could be mold as well. So that has to be handled in the right way and almost at the same time, but you have to keep that balance. That is where knowing a person's genetics and coming up with a customized protocol for each patient is the key. That's where, and then you bring all of these collaborating microbes and toxins, all of them down together little by little, and then they stay down. Which
that
is
totally makes sense.
It does, doesn't it? Yeah, that's why you need to be patient. Most people, when they see infections, they're like, let's go now. What do I have?
Yeah. Yeah. And I was never skeptical that it would not work, because I had researched it for a while, and I actually found you on a YouTube video, believe it or not.
Oh, right. Okay.
Yes, ma'am. I think it was a TED Talk, maybe. Did you do a TED Talk?
Okay.
Yeah.
A while back, I think.
Yeah. Yeah.
I've
No,
done
I
so
think
many
that's where I
talks,
found
honestly,
you.
I don't even remember too well. Maybe TEDx, if I recall.
Yeah, TEDx.
Maybe not. I don't know, but I'm glad you found me on YouTube. So now here you are.
Yep, here I am, and functioning pretty well.
Beautiful. Well, thanks once again. Thank you so much for being here today.
You're welcome.
So that was Cindy's story. It was very moving, and I'm glad she was here today to share that with us. For a long time, she was going through so much. It was difficult for her to believe that she would make it through. I think she always believed that, though. Yeah. Even though the doctor said, we don't know if you're going to make it. There's heavy duty infections, but I think she always had faith. I'm glad she did, because, I'm glad I was able to meet her, and I had the honor of helping her on her journey to the point where today she is almost asymptomatic, in pretty decent remission at this point. Her treatment continues. She's on a maintenance protocol right now. She doesn't need a full heavy duty one at present. Good. So I hope Cindy's story has inspired a few of you listening. And that's it for this podcast. Be well. Take good care of each other. Keep smiling. Always have faith. And I will see you at the next episode of BioNexus Health Podcast. Namaste.
Thank you for joining Master Herbalist Dr. Jodie A. Dashore, Director of the BioNexus Health Clinic and BioNexus Herbals, on the BioNexus Health Podcast, where we explore and share information and stories about recovering and healing from chronic and environmental illnesses such as mold biotoxin illness, Lyme disease, autism spectrum disorder, fatigue, Crohn's and colitis, mast cell activation syndrome, PANS, and more. Please help us grow our message by subscribing to our podcast channel and sharing the podcast on your social networks. For more information, visit bionexushealth.com.
Information within this video, audio, or text, collectively known as the podcast, has not been reviewed by the FDA. Nothing within the podcast is intended as or should be construed as medical advice. Information is for general informational and educational purposes only. Consumers of the podcast should consult with their healthcare practitioners for medical recommendations. Seek the advice of a qualified healthcare provider. Do not disregard the advice of a healthcare provider based on any information from the podcast. The information within the podcast may contain information concerning dietary supplements or over-the-counter products that are not drugs. Our dietary supplement products are not intended for use as a means to cure, treat, prevent, diagnose, or mitigate any disease or other medical or abnormal condition.